Osteonecrosis of the jaw is a medical condition associated with various factors, particularly certain medications used to treat bone diseases like osteoporosis and bone metastasis. While it has recently come to the attention of the dental and medical communities, the association between phosphorus compounds and jaw necrosis was actually observed much earlier. In the 19th century, workers in matchmaking factories exposed to high levels of phosphorus vapors developed a condition known as phossy jaw, characterized by exposed necrotic jawbone and high mortality rates. Changes in industrialization laws and the advent of antibiotics led to a decrease in phossy jaw cases. However, in 2003, cases of ONJ began to emerge in medical literature linked specifically to the use of bisphosphonates, leading to the term bisphosphonate-related osteonecrosis of the jaw, or bronch. The recognition of additional medications causing ONJ has since prompted a broader term, medication-related osteonecrosis of the jaw, or bronch. This evolution highlights that while bisphosphonates were the initial focus, the condition isn't solely tied to this class of drugs.
Understanding and defining ONJ has been an evolving process, and there's still some variability in definitions used across studies. Approximately 3 years after ONJ gained significant attention among healthcare professionals, a working definition was established. This definition typically included criteria such as exposed necrotic bone in the jaw persisting for a specific duration, often 8 weeks or more, in individuals who had been exposed to bisphosphonate therapy and had not received radiation to the head and neck region. This definition was useful in distinguishing ONJ from other conditions like osteomyelitis or osteoradionecrosis, ORN. 2 widely referenced definitions have been put forward by the American Association of Oral and Maxillofacial Surgeons, AOMS, and the American Society for Bone and Mineral Research, ASBMR. These definitions, and most others initially proposed, required the patient to have a history of bisphosphonate treatment. However, as experience grew, reports emerged linking ONJ development to treatment with other anti-resorptive medications, notably the monoclonal antibody denosumab. This broadened understanding has led some to question whether the earlier definitions, which specifically required bisphosphonate exposure, warrant revision. Some studies have used slightly broader definitions, like exposed necrotic bone of any size without regard to duration or cause, which can potentially include cases that might align with ORN or other diagnoses. A clear, consistent definition is crucial for accurate diagnosis, evaluation of treatment, and prevention strategies.
Research in humans has consistently identified several factors associated with an increased risk of developing ONJ or bronch. Key risks include the use of bisphosphonates, the presence of cancer, prior radiation therapy to the head and neck, osteoporosis, and, to some extent, the use of steroids. Several studies have generally concurred on these risk factors. Notably, a large proportion of ONJ cases have been observed in patients with metastatic cancer involving the bone